So now we have the man of the hour, Dr. John Mcdougall. And guys, he's going to be coming on not just once a month on Mondays, but he is going to come on twice a month because he has a lot of new lectures and he wants to test drive them on you guys. So aren't we honored to have him here talking about diabetes and what he would tell you if he were your doctor?
Right. I'm going to do a series. It's McDougall's Medicine. It's something I always dreamed about doing. Originally, I had it set up as an office situation where I would hire a model, have this person come in and act as the patient, and then talk about how I would take care of this particular person and have it filmed with the idea that other people might be interested in what I would say to a person in an office setting, because, just realistically, I wouldn't be able to get to everybody. Well, that was the original thought, and it's kind of smoldered in my brain for all this time. And finally, I figured out it could be done over the internet in a more powerful way. So we started out with the first lecture on precocious puberty and how your hormones get changed with a diet. And that's available on YouTube, and it's on our channel as well as on AJ's channel. And then the lecture I gave last time was on breast cancer. All the things I'd want to have a patient who had breast cancer know and are told. And so I'm going to do this whole series. This one's going to be on diabetes. These are the things that if I had a chance to sit down with you, I was the doctor, you were the patient. These are the things I want to tell you, the things that I believe. Whether you end up believing them or not, it's not the important thing. I think you need to be armed with the information that I have. And then you can reference that information with what other doctors say and decide what you want to do, decide what makes sense to you. And so this lecture will be on diabetes today. Then we're going to do one on autoimmune diseases, one on osteoporosis, one on heart disease, probably one on cancer, other kinds of cancers. And it's just going to be a whole series that we have set up. And AJ, I want to thank you very much for giving me the audience, because it's so much more realistic for me to know that I'm talking to people as opposed to just sitting in front of a screen. And hopefully it'll bring me to life. Yeah, I'd like to tell you about diabetes. I'd like to tell you about all the things that I'd like to tell you if we had a chance to sit down together, if I had a chance to be your doctor. And these things should be the things that you have. Your doctor should be telling you these things. This is a frank discussion a doctor should have with anyone facing a life with diabetes. You need to know these things. And I realize that some of this gets a little bit complex, but if you'll bear with me, I'll explain it to you, I think, in a manner that you'll easily understand it. It may take a few different repetitions of some of the same material. Plus, you're going to have the recording of this so you can go back and listen to it. Plus, I put a lot more information on the slides than I'm able to communicate with you. And if you just go back and look at the slides, you'll get a whole different perspective, an important addition to what words I said to you. Plus, I cited the scientific literature. And although I may go through the studies quite quickly, because quite honestly, you don't need to know all the details, most of you, but you need to know they exist. And for those of you who are more discerning, those of you who really want to know what's going on, you can look up these studies. Most of them are available without charge on the internet. So there's a whole bunch of information coming your way. Please bear with me, and we'll get through this all together. Diabetes. Well, the main criterion for diabetes is that the blood sugar rises above normal. Then you're diabetic. But there are two kinds of diabetes. There's type 1 and type 2. For both kinds of diabetes, the signs are, the most readily available signs are, when you check your blood sugar, it's above 126 milligrams per deciliter. When I started in medicine, it was over 200 milligrams per deciliter. That was the definition for diabetes. And then it went down to 160 milligrams per deciliter, and then 140 milligrams per deciliter. Oh boy, I wondered why the definition was changing. Well, I soon realized that the lower you make the number to call somebody diabetic, the more people you get into the business. So it's a way of opening up your customers to a greater number of them. Few people would meet the criterion of 200 milligrams per deciliter, and more at 160 milligrams per deciliter, a lot more at 140 milligrams per deciliter. And now they're down to 126 milligrams per deciliter. And there are doctors out there that would treat you if your blood sugar was above 100 milligrams per deciliter. They would tell you that you have prediabetes and we need to nip it in the blood with these drugs. Hemoglobin A1C, which is a long-term measurement, as you become diabetic when it's above 6.5%. Now, symptoms of diabetes are shared between type 1 and type 2. You have an increased urinary output, and that's accompanied by an excess of thirst. Another thing that happens, and I know many of you who are type 2 diabetic in particular, you look forward to this one, and that is you lose weight easily. But you can lose an excess amount of weight to the point where friends and relatives are worried about you. So those are the symptoms of diabetes, but more important are the complications, and that is that heavy diabetes, you suffer from a metabolic handicap, and the result is damage to all the tissues in your body, but particularly to the eyes, kidneys, nerves, and heart. You measure the blood sugar level either by taking the glucometer and sticking it in your finger or on your finger, and you get a value that is in terms of milligrams per deciliter. And if it's above 100 milligrams per deciliter, as I mentioned, it's considered abnormal. At 126, it'll be frankly diabetic. Hemoglobin A1C, well, this is a long-term measurement. You know, you're taking the instantaneous reading with a blood sugar measurement. But if you want to find out how the sugars have been controlled over a long period of time, say 2 or 3 months, what you do is you look at the hemoglobin A1C level. Now, less than 6% is considered normal, but levels can rise as high as 14%. I've known about this for a long time. I've talked about glycosylated hemoglobin back in my book that I wrote in 1985, and this diagram is actually from that book. And here you see a protein molecule that does not have a bunch of sugars attached to it on the left. And then because of high amounts of sugar in the blood, these sugar molecules get attached to the protein. In this case, we're talking about hemoglobin. And once the sugar gets attached to the protein, the whole molecular environment changes and you distort the protein. And this may be one of the major mechanisms that leads to these serious complications in the eye and the kidney and throughout the body, is these distorted proteins. So you want to keep the hemoglobin A1C down to a normal level, which is, let's just say 6%. That would be the amount of hemoglobin that is glycosylated, which is represented by a percent. Now, this will take a little bit of time, and I'm going to go through this with you in several occasions as we progress through the slide presentation. What I want to talk to you about is how blood sugar gets from your table into your intestinal tract, into your bloodstream, and then into the cells. We're going to talk about, first of all, a normal situation, no diabetes at all. In this situation, you have lots of insulin that works well, and you have lots of receptors on the cell that are very active. If we'll start at the top, what you see is the key. Insulin acts as a key to activate glucose transport receptors. You've got to have the insulin for your transporters to work. The bar that you see there in red is an inactive glucose transport receptor, and the one that looks like a Y is an active glucose transport receptor, and the blood sugar is represented by the orange triangle. So let's take a look at the first situation where you have somebody without diabetes, somebody who's functioning normally, somebody who's healthy. What you see is the insulin is acting as a key to open up the receptors and allow them to work, and the receptors are taking in the glucose and allowing the glucose to pass through the cell wall and get into the cell. That's a normal situation. We'll talk about the other ones as we go along. Let's talk about type 1 diabetics. Type 1 diabetics are just a smaller percentage of diabetics. Certainly less than 10% of diabetics are type 1, probably far less than 5% are type 1. which means that 95% of diabetics are the other kind, which is type 2. In type 1 diabetes, let's go back to this same graph here, the same image. And what you see in type 1 diabetes is you see plenty of sugar. The person's eating, the sugar goes into the bloodstream. There's lots of sugar around, and the cells are ready to accept these sugars and allow the sugars to pass into the cell where the sugars provide energy. But in this case, you don't have the keys to open up the cell wall. You don't have the insulin. And so as a result, the cells are starving because no sugar can get inside. This is a deadly condition that people develop, type 1 diabetes. And of course, you have to supply supplemental insulin in this case, otherwise the person becomes very sick and dies. Type 1 diabetes is due to destruction of the beta cells on the pancreas. The beta cells are insulin-producing cells. And this occurs through an autoimmune reaction where the body attacks itself. How stupid the body to attack itself. Yeah, but it does. And the reason it attacks itself is this, is animal proteins, they pass through the gut into the bloodstream. They're not supposed to do that intact, but sometimes they do intact. So you've got whole animal proteins. In this case, what we're talking about is the beta casein on the milk protein. This milk protein gets into the bloodstream and the body says, hey, this is a foreign substance. This could be a virus or a bacteria. I must make an antibody against it to destroy this foreign invading substance, which in this case is cow's milk. Well, the antibodies that are produced against cow's milk find similar structures on the beta cells of the pancreas. Yeah, and they get confused. They go and try and attack the cow milk protein, which is floating around the bloodstream, but they end up attaching to the surface of the cells that produce insulin. And in that manner, they destroy the pancreatic cells. That's how you develop type 1 diabetes, is through this autoimmune reaction. It's called molecular mimicry, if you want to look it up. And eventually it takes somewhere between 3 and 7 years. Eventually the pancreas is so destroyed that you're making insufficient amounts of insulin and probably no insulin at all. And so you have to supplement. In other words, you have to take insulin through a shot. These similar parts, the parts of protein that are similar between the cow's milk and the surface of the insulin-producing cells of the pancreas, are 17 amino acids. They are the same amino acids on the cow milk protein, the same amino acids on the surface of the beta cells of the pancreas. And so, well, the body, the antibodies, which are produced by the lymphocytes, are looking for the cow milk protein. They find, in addition, they find the same structure of 17 amino acids on the surface of the insulin-producing cells, and they attach to them, and they destroy them. If you want to read the original paper on this, it was published in 1992. They identified the 17 amino acids that are shared between cow's milk and you. And in the process of the body doing something normal, which is to defend itself from an invading foreign substance, it destroys your tissues. So how do you treat type 1 diabetes? Well, I take care of a lot of people with type 1 diabetes. In fact, I have to say it's one of the more fun doctor-patient relationships that I get involved in, most rewarding. Because here you take a look at people who have a difficult life ahead of them. They have all kinds of complications that they face. Within 11 to 17 years, most diabetics have developed serious disease to the eyes, to the kidneys, to the feet, or they've died. So if you could take and you can fix these people by putting them on the right amount of insulin and feeding them a good diet, the rewards are tremendous. Not just for the patient, but for the physician who needs to help people. So when I have somebody who comes in with type 1 diabetes, they're on insulin, they're going to stay on insulin. But we're changing their diet, and as a result, what happens is their insulin works more efficiently. So I have to cut their insulin dose, and usually I cut it by a third or to a half. And it's better to err on the side of too little. You can always add more insulin, but too much insulin can result in serious adverse effects, particularly hypoglycemia. And if you become too low in your blood sugar, in other words, hypoglycemic, what happens is you get confused. You can actually lose consciousness. And as a result of this confusion, what happens is you could get involved in an auto accident. You could be accused of a DUI. And you also subject yourself to injuries. Now, when I take care of somebody with type 1 diabetes, I do it in various regimes as far as their insulin dosages go. First of all, these people are never on pills or shouldn't be. They're on insulin only. And what I try and do is I try to minimize the time that a patient spends treating themselves during the day. And in some of these regimes, you have multiple injections that occur throughout the day, 4, 6, or more times you're injecting insulin. You're checking your blood sugars, you're making adjustments and so on. You know, that's an awful lot of time spent worried about your blood sugar levels and what kind of dose of insulin you're going to give. So what I try and do is make it as easy as I can for the patient, and I give them long-acting insulin. And my favorite one is Lantus, but there are other ones. And I strive to pick the right dose so they only have to take 1 shot a day. This may not be possible. They may have to take 2 shots of Lantus a day, and in some cases, they may have to add shorter-acting insulin, but that's not my goal. You know, I want to avoid hypoglycemia, but I want to give them enough insulin so that they're in good health and they can get plenty of sugar to pass into their cells so their cells are not starving to death. Now, of course, we only make this change in insulin dose after people get on the diet. And that's when I drop the insulin dosage by 1/3 to 1/2. All right, let's talk about type 2 diabetes. This is the kind of diabetes that you can cure. In fact, you should expect to cure it. Type 2 diabetes, here we go back to the same image. And you see in type 2 diabetes, what you have is you've got plenty of sugar in the bloodstream. Of course, people with type 2 diabetes, they have elevated blood sugar levels. And you have insulin that's present. In fact, sometimes the insulin is present to a level that is twice as much as a normal person. There's loads of insulin around. The problem is that the transport receptors are inactive. The body has developed insulin resistance, and we'll talk about why in just a minute. And so as a result, even though there's plenty of sugar, there's plenty of insulin around, loads of insulin that the body produces. What happens is the sugar can't get into the cells because the cells have developed insulin resistance. And that's type 2 diabetes. Do recall that I said that a type 2 diabetic has as much insulin and sometimes twice as much insulin as somebody without diabetes. Your lifetime risk of developing type 2 diabetes is about 40% for men and women. If you are a person of color, Hispanic or Black, then your risk of developing diabetes is higher. It could be as high as 50%. But it's not because of anything that is metabolic or genetic. It has to do with your living situation. And I have to say right off is that people of color, your Hispanics, your Blacks, they have less opportunity, less education, less opportunities to eat a healthy diet. And as a result, they end up more overweight with more various kinds of diseases, including strokes, pancreatic or prostate cancer, all kinds of problems. But it's unique to these particular populations of people, not because of their color. No, it has to do with the social, economic environments that they're involved in that causes them to have this inordinate excessive rate of type 2 diabetes. If you look at people who follow various diets, you see their risk of getting type 2 diabetes varies drastically. You know, your typical American diet, your non-vegetarian diet, you have a very high risk of developing type 2 diabetes. If you improve on this diet a little bit and you're semi-vegetarian, you have a reduced risk of diabetes. If you have a vegetarian diet with fish, even better, and a lacto-vegetarian diet. Remember, we're not talking about type 1 diabetes, we're talking about type 2 now. So the dairy issue is not important. You have a reduced risk of getting type 2 diabetes, and of course a vegan, which is the kind of diet that we promote. And there are a lot of high-fat vegan diets that this doesn't apply to. If we had a bar for somebody who ate a low-fat vegan diet, like the type of diet that I recommend, you'd find that the risk of type 2 diabetes is essentially zero. Around the world, as people become wealthier, you have populations living in these particular countries developing obesity, heart disease, breast cancer, colon cancer, prostate cancer, and more and more and more diabetes. And the studies, what we find is that the incidence of type 2 diabetes in China in 2018 was 12.4%. The incidence of prediabetes in China in 2018 was 50%. Half the population is pre-diabetic. However, before 1980 in China, fewer than 1% of the Chinese population had type 2 diabetes. Before 1980, 90% of the Chinese diet was white rice. And they didn't have diabetes. But in 1980, things changed for China and a lot of other nations around the world. They become wealthier. They took advantage of the harnessing of fossil fuels and the Industrial Revolution and all the technology out there. They listened to cable news and learned about how people of wealth, such as Americans, lived, and they wanted to emulate that particular kind of lifestyle, and they have. China is one of the richest nations on this planet. And that wealth has been translated into a diet that makes them overweight and sick, including diabetes. Now, I want to explain to you that type 2 diabetes is really not a disease. It's a normal adaptation which gives you advantages to survive. When late fall and winter approach, there's less food. And a good thing to happen to get ready for this time of less food would be to store extra fuel. And the body does that. It stores it as body fat so you can make it through times of near famine. That's normal. That's a survival advantage. And that allows you to maybe gain 30 to 50 pounds, but not more than that. You know, that's enough to get you through the winter. Not more than that, so it becomes a disadvantage. And the way the body accomplishes this is it develops insulin resistance. In other words, the body does not transfer the blood sugar from the blood into the cells readily because there's a decrease in glucose transporters. This is normal. This is natural. But what's not normal and what is not to the advantage as far as your survival is concerned is to become morbidly obese. That's puts you in a situation where you are easy prey from the saber-toothed tiger. You know, if you were to gain an extra 100 pounds and sometimes as much as 800 pounds because you didn't develop insulin resistance, which is the normal situation. And I see people who do this. I see patients who weigh 500 pounds. I've seen news stories where they had to take a forklift into the bedroom of a patient that weighed over 1,000 pounds. What happened is these people did not develop insulin resistance, which would protect them from morbid obesity. You know, for becoming a size where you couldn't climb up a tree and get away from the saber-toothed tiger, to a size where you couldn't get into the small opening of the cave. So it's normal and natural. It's an adaptation to develop insulin resistance, which we call type 2 diabetes. It's not in the classic sense of disease or something going wrong with the body. Nothing wrong with the body. It's doing what it's supposed to do. So how do we treat type 2 diabetics? Well, they've got plenty of insulin. They've got plenty of blood sugar. So what I do is when I see somebody with type 2 diabetes is I stop the medication. I stop all of their insulin, or at least most of it. And I have some people who see me who weigh as much as, or are taking as much as 120 units of insulin a day. I know you think this sounds brave for me to do this, but I know, first of all, that the oral medications are medications that are used for non-insulin dependent diabetes, which is type 2 diabetes. Type 2 diabetes is described as non-insulin dependent. It means that you don't have to take insulin. You don't have to take pills. The pills are dangerous, as we're going to talk about. And so it's important to get people off the medication so that they feel normal, act normal, and can get healthier. But just treat it with a healthy diet. And of course, that healthy diet is a starch-based diet with fruits and vegetables. All right, now I want to talk to you about something that's within the spectrum of diabetes. You know, you have the type 1 where you're not making any insulin. You have the type 2 where type 2 diabetics where you have loads of insulin. And then you have something in between. You have partial insulin insufficiency. You make enough insulin to keep yourself out of the hospital, keep from dying with ketoacidosis, but you don't make enough insulin to keep the blood sugar normal. And let's take a look at this. You see the situation with type 1.5 diabetes or partial pancreatic insufficiency. You see that situation where you've got some inactive receptors and some active receptors. You've got plenty of insulin, you've got plenty of sugar in the bloodstream, but not enough sugar gets into the cells. Too much sugar stays in the bloodstream, which is measured as an abnormally high blood sugar level. That's type 1.5 diabetes. And that's what confuses a lot of people. People will come into my practice and they'll go on a healthy diet and they'll lose a lot of weight, which, as you'll learn in a minute, cures most of people with type 2 diabetes. They'll lose a whole bunch of weight and still their blood sugar is elevated. Well, it's because your pancreas is not functioning as well as it should, and your cells have developed partial resistance. And as a result, you have type 1.5 diabetes. And the way we treat this, well, I treat type 1.5 diabetes is kind of a hybrid between just food and taking insulin. What I do is I give them enough medication so they won't end up in the hospital. And that medication is always insulin. It's never oral medication. It's never pills of any kind. Never shots that are not insulin shots. It's only insulin to take care of these people with type 1.5 diabetes. And you have to pick a dose. And picking the dose is just a guess, ladies and gentlemen. You know, I see somebody, I take a look at them, I listen to their history of what their blood sugars have run, you know, how overweight they are, and I take a guess, you know, how much of pancreatic insufficiency do you suffer from? In other words, how much supplemental insulin will I have to give you? Well, most of these people, I drastically reduce the insulin that they're taking, or probably most of the time I stop the insulin that they're taking, and I will add it back if necessary. And again, it's better to err on the side of too little medication rather than too much. You know, too much medication could result in severe hypoglycemia, brain damage, eye damage. You know, it's a big deal to overtreat. So say I take a guess as far as how much insulin I need to give somebody with type 1.5 diabetes. Enough medication so that they don't end up in the hospital. Enough medications so that their blood sugars are maybe a little bit better, but not normal. Well, this person, after a while, what happens is they may develop too much weight loss. Remember, insulin not only drives sugar into regular cells, but it drives fat into fat cells. And if you don't have enough insulin or it's not working efficiently, what happens is you end up losing weight because fat is not being allowed into your fat cells. Now, with the elevated blood sugar, what happens is you develop frequent urination, which can be troublesome, and that's accompanied by excess of thirst. But another issue that causes me to treat people with type 1.5 diabetes is everybody's worried about them. You're worried about your blood sugar numbers because they're elevated. Your mother-in-law is worried about your blood sugar levels. Your doctor's worried about your blood sugar levels, and so is your dietitian. Well, one way to get rid of the worry is to put you on a little bit of insulin. Then everybody thinks that all is going well. You're being treated by a doctor who really knows and cares. So I'll add a little bit of insulin to those circumstances too. But believe me, If you have partial pancreatic insufficiency, in other words, type 1.5 diabetes, you're at risk of becoming way too thin. And you may need an extra amount of insulin to allow the fat to get into your fat cells. But remember, not so much insulin that you develop hypoglycemia and get into big trouble there. That low blood sugar, that hypoglycemia causes brain damage, eye damage, and other damages to the body. All right. I want to share with you some facts that you may not realize are true. And that is weight loss from any approach cures type 2 diabetes. Now, the common approaches for losing weight that are not the McDougall approach is you can diet. In other words, you can restrict the amount of food that you eat, and then you suffer the pain of hunger. Or you can lose weight with bariatric surgery. In other words, the doctor can come in and rearrange your intestinal tract so that you lose weight. Well, surgery is painful. Surgery costs money, and there are lots of risks from surgery. And then you can lose weight from a low-carb diet. That's the opposite of the McDougall diet. But you must realize that the way you lose weight on a low-carbohydrate diet is you become sick. But the first approach that I want to talk to you about is calorie restriction, dieting. And what happens is the doctor may say to you, if you just lose weight, Mabel, if you just lose weight, your diabetes will go away. And you believe it, and it's true. Just weight loss will cause your diabetes to improve or go away. So here's the situation. You go to see a doctor, and the doctor says, Mabel, you're going to get rid of your diabetes by losing weight. I want you to follow this diet I got from GlaxoSmith Drug Company. One of the representatives came in and gave me a one-page sheet that teaches you how to diet. So I want you to follow this diet. I want you to lose some weight, but because your blood sugar's up, I must put you on medications, and these medications cause weight gain. Insulin does. So do many of your other medications that raise the insulin levels. Remember, insulin forces fat into fat cells. So here you leave the doctor's office with instructions. You're supposed to lose weight. You were given a diet. You're supposed to take the medications. Well, the medications cause you to gain weight. So you go back to see the doctor the next month, and the doctor says, hey, Mabel, get up on the scale. And the doctor walks over to the scale and says, hey, you have gained weight. I told you to lose weight. And now your blood sugars are higher. Now I've got to give you more medication. And you get into this vicious downhill struggle. The pills are causing you to gain weight. You hardly stand a chance of losing weight by certainly calorie restriction. To stop this vicious cycle, what I do is I stop the medication. I stop the main cause for people gaining weight. As a result, they start losing the weight, and yes, they can cure their type 2 diabetes, not type 1, but type 2 diabetes, just by losing weight, and that can be accomplished by dieting. Bariatric surgery. There's been a tremendous amount of research done. Of course, this is a very profitable business, so what would you expect? And what is found by causing surgically induced malabsorption and sickness? They rearrange your stomach, they put bands, they put sleeves, all kinds of things to make your intestinal tract abnormal so that your eating behavior will not result in obesity. In fact, you'll lose weight. And these studies have found that 78% of people cure their diabetes just with the weight loss caused by bariatric surgery. So it's almost 100% curable by just losing weight. Low-carb diets like the Atkins diet cause people to lose weight. They initially lose water weight. They lose 6 to 8 pounds when they stop eating any types of sugar. They burn their glycogen off, which is stored in their livers and muscles, and they'll go and lose about 6 to 8 pounds of water. And then what happens if you stay on the Atkins diet for a little longer, you go into ketosis. That's one of the main principles of the Atkins low-carb diet is you need to go into ketosis, which is described by many people as a state of bliss. It's not a state of bliss. It's a state of sickness. And so you end up losing weight, and as a result, your diabetes can get better. But I want to point out to you, these diets are very dangerous. I could provide for you 5 large reviews that have looked at the low-carb diets and show that these diets increase your risk of dying and suffering from heart disease. So, don't be fooled. Weight loss is just one of the things that's accomplished. I wrote an article that was published in Mayo Clinic Proceedings, and you could read that whole article if you want. It's on the right-hand side of the slide. But it was in response to somebody who was bragging about the benefits of a low-carb Atkins-type diet. They said, not only do you lose weight, but you lower cholesterol and blood sugar and triglycerides, and and in that way you can cause the patient to be healthier. And it's not just weight loss; they'll be benefited by having a reduction in risk factors, which can be translated into better health. Risk factors like cholesterol, triglycerides, and blood sugar. Well, I pointed out in this particular letter I wrote, I said, you can also lose weight by taking cancer chemotherapy. Cancer chemotherapy. What happens is you lose weight, you get sick. Like with these low-carb diets, you get sick. And as a result of sickness, you don't eat. And your blood sugar comes down, your cholesterol comes down, your triglycerides come down. Yes, they do. Yeah. Similar benefits for similar reasons are seen when patients undergo cancer chemotherapy, like with the low-carb diets, and physicians do not brag about these results. Can you imagine if you went to a doctor and the doctor said, it's weight loss, and I can make you sick enough to cause you to lose weight? Well, you got the similarity there. So how do I take care of people who have type 2 diabetes? The thing that you need to know is you have to be very careful about the treatments that you use, because not only do diabetic drugs lower blood sugar, but they also kill type 2 diabetic patients. I tried to get some legislation passed in the state of California where the state of California would require that doctors put out an informed consent when they saw diabetic patients and they treated them with these medications. An informed consent will require that the patient be told that taking these medications will increase their risk of dying. Yeah. Well, let's talk about medications that are used. The first-line therapy for treating type 2 diabetics with medication we're talking about now is metformin. And oh boy, doctors think this is such a great drug because it doesn't cause weight gain and it may actually help the arteries. That's what they say. And more than half of the 58 million Medicare patients are on metformin for their non-insulin dependent, remember, you don't have to take insulin, type 2 diabetes. Well, it's highly questionable whether this medication is of any benefit at all. For example, a meta-analysis of the clinical trials that have done using glucose, or those using glucophage metformin to treat type 2 diabetics, they couldn't rule out a 31% increase in all-cause mortality, nor could they rule out a 64% increase in cardiovascular mortality. In other words, the claim that it reduces your risk of dying of heart disease is just plain and simple not supportable. And this review in the British Medical Journal, what they concluded was the results of the study do not justify aggressive treatment of type 2 diabetes using metformin. Another study, a meta-analysis of randomized trials of people with type 2 diabetes using metformin, and specifically looking at whether they reduce the risk of dying of strokes and heart attacks or having heart surgery. Well, the conclusion is there remains uncertainty about whether metformin reduces the risk of cardiovascular mortality. And I have to tell you, the idea that somehow metformin can help the arteries, the big arteries, like the ones that go to the heart and brain, and the small arteries that go to the retina and the kidneys and your peripheral nerves, is based upon the finding that Only this finding that eye damage is reduced based upon photographs of the eye, which are subjectively evaluated. That's it. It's not a reduction in diet of heart disease or strokes or having heart surgery. It's just based on these photographs of the retinas. Second line therapy is sulfonylureas. There's a whole list of sulfonylureas down there. About 30% of sales of diabetic medications are represented by sulfonylureas, which were also used as herbicides. Back in 1972, the physician's desk reference started coming out with warnings on all oral diabetic medications. These specific warnings started out with a statement at the beginning of the paragraph. This was in heavy black print at the beginning of the description of the drug in the physician's desk reference, which is a book that almost every doctor used to have on their table that they used all day long to determine the benefits and risks and hazards and costs and so on. Not costs, but benefits and risks and scientific studies and so on, to decide whether or not they were going to use a particular medication to treat their patients in heavy black print. Based upon the UGTP study, they found a rate of cardiovascular, that means strokes and heart attacks, mortality to be approximately 2.5 times that of patients who were treated with diet alone. And that warning has continued up to this date. These drugs are dangerous. There are 6 major studies, and only 6 have been done. And I'm going to show you these studies. You can go look them up later on. I'm going to give you the basic conclusions. These studies show that aggressive treatment for diabetes kills. Aggressive treatment, what that means is using lots of pills, using lots of insulin when necessary. I mean, sometimes they'd give the patient four shots of insulin a day, and they would check their blood sugar 4 or more times a day. They'd have them on 3 or 4 different kinds of medication. That's aggressive treatment. And the goal of aggressive treatment is to get the hemoglobin A1C down to about 6%. That's what they tried to do. So they did some randomized control trials, and one group got standard care. In other words, they didn't pay a lot of attention to their hemoglobin A1Cs, and they let them run approximately 8 to 9%. And the other group, the intervention group, they really treated them aggressively. And here are the results of the studies, of the 6 studies done. Oh, by the way, before I tell you this, you must understand that whether or not a drug was approved by the FDA to be used to treat diabetics depended upon whether or not it lowered blood sugar. Didn't have anything to do with whether or not the patient ended up healthier. I mean, you couldn't outright kill the patients with the drugs. But the main criterion as to whether or not you are able to advertise yourself as a diabetic medication is whether or not it lowered blood sugar. So here are the 6 different studies that have been done. You have the Diabetes Control and Complication trial, which was published in 1998. And the conclusion is it may increase the risk of coronary artery disease in this subset of subjects with time. And then you had the Veterans Affairs Cooperative Study. They found a strong tendency toward worsening cardiovascular outcomes in patients with intensive control. When you aggressively treated the patient, more heart disease. And then they had the TRACE study, the largest European study ever done. And they showed an increase in mortality following acute myocardial infarction when you aggressively treated the patients. And then in 2008, the New England Journal of Medicine came out with 3 major studies that really put the nails in the coffins of the diabetic industry. If scientists, doctors, politicians would have listened to the results of the study. These 6 studies, you have the ACCORD study, which was published in 2008. The Heart, Lung, and Blood Institute stopped this study 17 months early because of an increased risk of dying in the aggressively treated group. 17 months early, it was stopped. You have the ADVANCE study. The ADVANCE study showed no significant effects when it came to reducing the risk of major vascular events like strokes and heart attacks. No benefit. And hypoglycemia was much more common in the aggressively treated group. And then finally, and this is the last of the studies done, finally, we have the Veterans Affairs study. And what they found was that those who were treated aggressively gained an average of 18 pounds compared to 9 pounds with a standard group, and sudden death was 3 times higher. Ladies and gentlemen, there are no other studies of this level to help you to decide whether or not you're going to take these medications. Diabetic drugs kill. So effort to reduce the hemoglobin A1C down to 6% resulted in a dramatic increase of poor outcomes, including death. Well, the control groups were 8 to 9%, the hemoglobin A1C, and with the intervention groups, they got close to 6% in these various trials. What did doctors do about this? Well, they knew you couldn't lower the hemoglobin A1C down to what is a normal level of 6%. That was just dangerous. And sometimes these hemoglobin A1C levels got up to 14%. So what are they going to do to come to recommendations for your doctors to treat you? Well, just based upon a hunch, just a guess, no data. I mean, there's no data that shows that somebody with a hemoglobin A1C level of 7 or 8% does better than somebody with a hemoglobin A1C level of 10 to 12%. We know they do worse when it's down to 6%. They proposed as a compromise, based on a guess, not data, that the goal your doctor should have for you to get your hemoglobin A1C is down to 7 to 8%. Huckaday made a very important statement back in 1987. He said, "It is important to remember that diabetic control means a lot more than blood sugar control. Not only do we have to control the blood sugar, we've got to keep the patient alive and healthy. We got to be concerned about them dying. We got to be concerned about them suffering from illnesses, heart disease, eye disease, and kidney disease." Well, industry responded, and they developed newer drugs that you see advertised on your cable news network, intensively advertised because they're so darn profitable. And they developed drugs that actually reduce the risk factors associated with cardiovascular disease, strokes, and heart attacks. But these particular drugs have other problems. And I'll show you the 3 classes of drugs that are done in the studies that evaluated their benefits as well as their troubles. In 2008, the Food and Drug Administration, they said, you ought to start paying attention to other things besides just lowering blood sugar. And they gave some guidance. Nothing enforceable, nothing legal. They just told the drug companies that you probably should pay better attention, and they responded with these particular drugs. These are the drugs that have been advertised as reducing your risk of dying of heart disease and strokes, cardiovascular mortality. Yes, because as I showed you, the 6 major studies showed the other drugs dramatically increased your risk of dying of heart disease. So industry, bless their hearts, they decided that they were going to answer this call to make drugs that reduce risk factors associated with having strokes and heart attacks. So one of the studies that was done on this particular medication showed, this is Jardiance medication. They showed that you reduce the risk of cardiovascular complications by 2.2%. That's all, 2.2%. Whereas they also increase the risk of genital infections and leg and foot amputations. Victoza, that's the one that's advertised a lot to you, 1.3% reduction, 1.3% reduction in cardiovascular complications, but it increased your risk of gastrointestinal problems, particularly pancreatitis, caused low blood sugar reactions, kidney damage, and thyroid cancers. And the last class of drugs What they did is they found that it reduced the risk of cardiovascular problems by a lousy 2.3%. But you ended up with more eye damage and with the possibility of blindness. These are very profitable medications, ladies and gentlemen. That's why they are promoted so much to you. But they fall way short of what you think the drug company should be able to do, or what you hope they'd be able to do for you. All right, I want to straighten out some other misinformation so I can talk to you about the proper way to treat diabetes. First of all, you need to understand that diabetes is not caused by sugar. It's not. We knew that a long time ago. We knew that in 1927 when Shirley Sweeney treated his medical students with various kinds of diets and then did glucose tolerance tests on them. And what you see along the x-axis, you see the times and you see the blood sugar levels along the y-axis. And what he did is he took the students, he fed them a diet that was very high in sugar. That diet consisted of table sugar, candy, pastries, white bread, baked potatoes, syrup, bananas, rice, and oatmeal. And all of his students tested non-diabetic. They were normal. And then he fed the same students a high-fat diet, olive oil, butter, mayonnaise, egg yolks, 20% cream, and all of his otherwise healthy students became diabetic based on the glucose tolerance test. Percival Hemsworth, he established this with beyond any doubt. There was a high-fat diet that caused diabetics to get worse, their blood sugars to get high, and that a high sugar diet, a high carbohydrate diet, resulted in normal blood sugars. And he published this data in the British Medical Journal in 1940. Percival Hemsworth is the father of diabetes. Brunzell did studies at University of Washington that were published in 1971 in the New England Journal of Medicine. What he did is he took type 2 diabetics and he started them out on a diet that was 45% simple sugar. And they weren't starches, they weren't complex carbohydrates, they were simple sugars, dextrans and maltose. And then what he did is he doubled the sugar intake to 85% of the calories from simple sugar. And what he found is every aspect of diabetes improved. Yeah. Fasting insulin was lower, glucose tolerance tests were lower, blood sugars fell, fasting blood sugars, every aspect of diabetes improved by doubling the amount of sugar fed to his test subjects. And what they conclude, these data suggest that a high carbohydrate diet increased the sensitivity of peripheral tissues to insulin. In other words, sugar makes insulin work better. Walter Kempner, Duke University, developed the rice diet, which is a diet of fruit juice, simple sugars, and white rice. And he got tremendous improvements in the health of his patients. But one of the things you need to note is they essentially cured 100% of type 2 diabetics with this diet. And here's the diet. Standard American diet is about 38%. The diet of rice and sugar was 2% fat, 4% protein, and 94% sugar. And in patients who needed to gain weight, they would often feed them 2,000 calories of white sugar to add extra calories to the diet. And yet the improvements in health in patients are not matched by any other diet or any other approach. Curing malignant hypertension, curing type 2 diabetes, curing or stopping the progression of kidney failure and heart failure. If you don't know Walter Kempner, you should learn about Walter Kempner. I talked about him in my December 2013 newsletter. Type 2 diabetics, when they were fed a diet of omega-3 fats, fish oils, what happened to their diabetes is it got worse. Oil paralyzes insulin, makes the cells more resistant to insulin. Sugar makes insulin work better. Now, how in the world are you going to get well if you don't know this, if you can't straighten out this this contrary information to what the truth is and what you've been told. You don't stand a chance. So when they fed omega-3 fats, fish oil supplements, what happened is the blood sugar increased by 22%, and the blood sugar after meals increased by 35%. Now that was type 2. And when they treated type 1 diabetics with oil or high-fat meals, it wasn't oil tablets or capsules, it was high-fat meals. What they found is that type 1 diabetics, those people who have to take insulin, what happened is their requirement for insulin increased. On the low-fat diet, they required 9 units. On the high-fat diet, they required 13 units of insulin. They require more insulin because fat paralyzes insulin activity. Now, just want to touch on the potato for just a minute because the potato has been so maligned. There are people out there that say type 2 diabetes is caused by eating potatoes. Well, the research really shows that if you eat fried potatoes, what happens is you have an increased risk of developing type 2 diabetes. But the final study, the final verdict was in this study that was published, which looked at non-fried potatoes and found out that they do not raise blood sugar levels. They do not cause diabetes. In fact, just the opposite. So let's talk about the low-fat diet that I use to treat type 2 diabetes. And my most important mentor as far as learning this diet so that I could help you with your care, it was Nathan Pritikin. And again, if you don't know about Nathan Pritikin, you can find out about him in my February 2013 newsletter, which is on my website. And the diet that I use is patterned after this pioneer, as well as several other pioneers in the field of medicine that came before me. Let's take a look at the history of using a high carbohydrate, like I recommend, low-fat diet and taking care of type 2 diabetics. This was by a man named Rabinovich, and he treated 500 patients. He had 16 failures. Patients were highly satisfied by using a high carbohydrate, low-fat diet. Back in 1930, he published this. He also said that patients would rather eat a healthy diet than to take insulin and to be underweight. They'd rather eat a healthy diet and cure their disease. This was back in 1930. I talked about Walter Kempner and his findings, which were published in the late 30s and during the 1940s and 50s. Essentially cured all the type 2 diabetics with a diet of white rice, fruit juice, and simple sugars. Pritikin, in his reports, Nathan Pritikin found that they were able to lower glucose levels from 183 to 150 milligrams per deciliter. They were able to decrease medication from their patients taking a total of 284 pills down to 75 pills. And on average, they reduced the shots of insulin from 280 to 158 injections. Or no, excuse me, the patients who required ejections went down that level, injections of insulin. And then we have from the University of Kentucky, we have James Anderson, who published his work in the late 70s. And he put people on a high carbohydrate, low fat diet, kind of patterned his diet off of Nathan Pritikin's work. And what they reported, this is one of the most respected universities and one of the most respected researchers in the world at that time. Insulin usage, the average reduced their amount of insulin from 26 to 11 units daily. And their diet was not as strict as the diet I recommended, the diet Nathan Pritikin recommended. And 11 of the 20 patients discontinued their insulin. David Jenkins from University of Toronto, he did an experiment where he put people on a vegetarian, low-fat, high-carbohydrate diet, and improvements in blood sugars in diabetics with 39% stopping their insulin and 71% stopping their pills. Neil Bernard, who is alive, well, and active for the Physicians Committee of Responsible Medicine, published a study recently in 2006 where he compared the American Diabetic Association diet with the vegan diet. It happened to be essentially our diet, the McDougall diet. And what they found is the hemoglobin A1Cs decreased down to minus 1.2, as opposed to an increase in the American Diabetic Association diet. The vegan diet, as I mentioned, was a diet very similar to what I recommend, as opposed to the American Diabetic Association diet, which is a relatively high-fat, low-carbohydrate diet. Nathan Pritikin used to say that the American Diabetic Association diet guarantees that all diabetics will remain diabetic. Yeah, that's what he used to say. And of course, we have our work, which is published recently, and we found nearly 90% of the 1,703 people that we studied and reported on were able to reduce or stop their diabetic medications. So how about, that's treating the diabetes. How about the complications of diabetes, which lots of people suffer from and would very much like to have improved? Problems with the blood vessels, the small blood vessels, problems with the eyes, problems with the kidneys, problems with the nerves. Let's take a look at the research here. Let me start by giving you a quote from Elliot Joslin of the famous Joslin Clinic. Many of you have heard about Joslin. He prophetically wrote in 1927 the following, and I'd like to read this to you. I believe the chief cause of premature atherosclerosis and diabetes, save for advancing age, is an excess of fat. An excess of fat in the body, obesity, an excess of fat in the diet, and an excess of fat in the blood. With an excess of fat, diabetes begins, and from an excess of fat, diabetics die, formerly of coma and recently of atherosclerosis. In 1927, he wrote this. And by the way, he continued by saying it shouldn't be long before, with good scientific study, we have this all figured out. Excuse me, it's been what? Almost 100 years. One of the complications of diabetes of both kinds is to have the retina of the eye be damaged. And the damage you see by looking inside of the eye, the damage you see here on the left, you see the white materials, these are exudates, and then you see the red flamed spots there. These are hemorrhages. And you see in this particular patient, just over a short period of time on a very low fat diet, they were able to reverse their diabetic retinopathy, which could have caused this person to go blind. And of the 44 patients that they studied, 20 of them showed this kind of improvement, dramatic improvement. And Walter Kempner wasn't the only one, a fellow by the name of Van Eck. He did similar studies using a low-fat diet and confirmed that you reverse diabetic retinopathy. And how is that treated these days? Well, with lasers. I prefer diet. The kidneys are affected by the kind of diet that you feed a person. A low-protein diet reduces the progression of kidney disease and death on average by 33 to 50%. You know, this has been known for 100 years. As far as pain in the feet, burning of the feet, numbness of the feet, which is called peripheral neuropathy, we have a couple of studies that should cause your interest. One was done at Weimar Institute by Milton Crane. What he found was complete relief of these peripheral neuropathies. The pain occurred in 17 of 21 patients put on a diet similar to what I recommend, and that occurred within 4 to 16 days, and their benefits remained for 4 years. So the message here is you can cure peripheral neuropathies, or at least benefit them. And there's no other treatment of any help out there. There's no drugs that solve this problem. And Neil Bernard, he published a study recently in 2015 on the effect of a healthy diet, a diet essentially the same as what I recommend. And he found that it helped with diabetic neuropathy. People got better. So to conclude, If you're a diabetic, type 1 or type 2, but particularly type 2, my question to you is, are you tired of being managed, switching from one drug to the next, waiting for the next complication to occur? Are you really tired of being treated the way that people are standardly treated in the medical system these days? Well, if you are, then you might look to the cure. The cure is a healthy diet and associated weight loss. It works. Costs you nothing. There are no side effects. And you can learn this diet free from my website, drmcdougall.com, or you can take the 12-day telemedicine, telehealth course that we teach, where you get support from our physician, support from our support staff, which meets you every morning and sees how you're doing, sees what your blood sugar is, works with you on the day's meal plan, where you can take advantage of multiple lectures from experts, the world's best experts: Doug Lyle, Jeff Novick, Anthony Lim. And you know what? I even lecture at the program. In fact, Mary and I have a chance to spend every morning with you at a fireside chat. It's a great program, folks. And the way you sign up for it is to go to our website. The next class is full. We end up filling up almost every class long before the time is due to start the class. But there are future classes that you can sign up for. All right. Well, thank you very much for listening. I hope I shared a few concepts with you on taking care of diabetes, how you can cure it, what causes it.
That was so good, Dr. McDougall. That was amazing.
Well, I hope it caused you to have no faith and a lot of suspicion at the current way diabetics are treated.